Hi everyone, I hope you're doing well in this pandemic period. I'm talking to you about a new campaign that was launched last March during the crisis of the pandemic, and we are still continuing today. The Foundation of Stars had created the campaign named Health Advance Pediatric Research on COVID-19. Today we have the chance to have Dr. Fatima Kakkar, an excellent doctor and researcher, that will be talking about a new project which is really understanding the response of the COVID-19 on children and especially on their family, what's really the impact. Therefore, Dr. Kakkar, starting with the project, would you be able to explain us a bit more the objective and the detail of that project?
Sure. Thank you so much, Jose, and thank you for highlighting the role of children in pediatrics and COVID research. So we're in the middle of a pandemic right now, and one of the key questions everybody wants to know is if we've had COVID-19, are we protected? And if we're protected, for how long? And so this study is actually going to look at the response to the virus and compare children versus adults. And I'm going to tell you about where this study came from, because it really came from my work as a COVID doctor. So when I'm not doing research, I'm on the COVID wards. And one of the things that struck me the most during this pandemic has been how different children have responded to their parents. I think one of the most heartbreaking cases I had is a little girl who was hospitalized, and she did fine. She went home after 2 days. But poor girl, her father died of COVID, her grandmother died of COVID, and yet they all had the same virus at the same time. And it's the same whether I'm calling parents to tell them their children has COVID, or I'm seeing them hospitalized. Children within the family tend to do better. They're better within 24 hours, 48 hours, whereas their parents are coughing, are sicker, or going to hospital. So this made me think there is something special in how kids are reacting to COVID that's very different from adults, and that there's something about children that's protecting them. So that's really the origins of this project, is to study the immune response, and not just to look at kids and parents separately, but to look at the same family where people have the same genetics to see what makes it so different in children and why are children so protected. So we're going to be enrolling not just children and adults, but whole families who've been affected by COVID to look at the immune response. And hopefully in doing that, we're going to answer those questions. We're going to see, am I protected from COVID, for how long? But most importantly, we're going to try to figure out what part of the immune system is protecting children, and hopefully use that information to help treat adults in the future.
I guess that's what's most important. I mean, it's very sad and scary, which is the example you just gave us. But at the end, if you can find something, I mean, we could treat adults from children, which is fantastic to get that element and that information. Basically, is there anything else you can add in the uniqueness of this product? The project?
So it's unique in that, yes, we're enrolling the entire family, and I also have a terrific team of collaborators. So I have basic science researchers, immunologists, virologists, and for years we've been working together on other viruses like HIV and CMV, but we have this expertise. So suddenly, in response to this pandemic, our team's going to come together and put our expertise to try and come up with this solution. So to try and understand what part of the immune system we need to work on to really help out adults. So I think putting this team of experts together and focusing on the kids is really the key. And I am really grateful to the foundation for really highlighting the role of children, because I think they're going to hold an answer to getting us out of this pandemic.
I think so too. Thank you so much. Just to close on this, do you think, I guess we all know financing is so important in that context, and we need to get that financing to get you going, and therefore we need to find those solutions in terms of adults and kids. So please tell us the last few words on how important you need financing to get that solution out and fast and urgently.
It is critical because research has to happen now. We can't wait 6 months or a year. We need these answers now. And it takes money to recruit these families and do these tests and do these analyses. And unfortunately, we don't have the luxury of time to wait 2 years for these responses. So unlike anything we've ever done before, we're ready to go. If we have the money, we're ready to enroll. And we need those results within months and not years. So really urgent. And I really thank you and the foundation for looking out for us and trying to raise this money, because it's going to be, I think, one of the keys to getting out of this pandemic.
Thank you so much to explain us all the importance of this project. And we really all hope to get financing for you and your colleagues. And we just have to go on foundationofstars.ca, and please donate, everyone, if you can, because we need to find those solutions. Thank you so much, Fatima.
Thank you, José.